Weak glutes or butt muscles are one of the most common causes of knee pain. And in this video, I'm going to show you 3 glute strengthening exercises to help if you have knee pain and particularly if you have knee arthritis. If you think about the things that bother people with knee arthritis, it's things like going up and down stairs, getting up from the floor, getting up after having sat for long periods of time, or squatting or stooping down to pick something up. And so these 3 exercises are going to simulate those functional activities that you do in your everyday life to not just get you muscle strength, but to get you functional muscle strength that improves your quality of life. So if you're ready to get started, let's go. The first exercise is designed to help with getting out of a chair or stooping down to pick something up. And those both involve a combination of your quadricep muscles and your glute muscles. But we want to do this in a way that minimizes the use of the quadriceps while maximizing the use of the glutes. Because when you use your quadriceps, it creates more compression on your kneecaps, which is particularly problematic if you have kneecap arthritis. And so to do that, I'm going to start showing this from a side view. When you stand up from a chair with your weight really far forward on your knees, it becomes a quadricep dominant activity. Same thing if you're squatting down to pick something up from the floor. If your weight is more on your toes, it's going to use a lot of quadricep force. Conversely, if you sit back towards your heels as you're going to pick something up, that uses a lot more hip extension or gluteal strength. So as we're doing this exercise, you want to focus on keeping your weight more back towards your heels to maximize the hip extension part of the movement while minimizing the knee bending portion. So as we're going down in the squat, we're going to start out in front of a chair and have it behind you so that if you lose balance, you can just sit down safely. But start from a standing position. You want to spread your feet to a comfortable position. It's probably going to be slightly wider than hips width, about shoulder width apart, but just do what feels natural and comfortable for you. Then you want to turn your knees out slightly, and I'll show that from another view in a second. Then focus on sitting your weight back towards your heels. So you'll notice as you put your weight back towards your heels, that the weight goes onto the heels, your butt goes backwards, and your trunk goes forwards. And that's okay. You have to lean your trunk forwards in order to not fall backwards. Because if you're pushing your hips backwards and keeping your trunk upright, gravity is just going to take you that way. It's physics. So it's okay to bend forwards a little bit as you're doing this hip hinge type of a movement. Now, as you get lower into that hinge, your knees are just going to bend naturally. But if you think about squatting or bending your knees, it's more likely going to become quad dominant. So push the weight back on your heels, stick your bottom out, reaching back for the chair, and allow your knees to bend. This is a combination of both glutes and quads, but the more backwards on the heels you keep your weight, the more glute dominant it becomes. Now, if you're a little bit more advanced and you can get lower, then start doing it further back and sitting lower than the surface of the chair. Just don't go so low that you end up falling backwards on the floor. Now, to see that from the front view, you want to again set your hips at a width that's comfortable for you. So find the width that's comfortable. Now you may notice that your toes don't necessarily point straight ahead, and that's okay. You just want to turn your knees out so that you've got your hips, knees, and toes all in the same alignment. Now you might notice that your arch starts to lift up here a little bit, and that's okay. But then grip the ground with your toes, kind of use your toes to make a stable base here because that's going to be what you're pushing through. Then slowly sit back, pushing your hips backwards as before. Your knees will naturally start to bend a little bit. The lower you get, the more the knees will bend. Sit back, keeping the weight on the heels, and think about driving the knees outwards. That's what activates your glutes. Your gluteus medius and gluteus maximus are both hip external rotators, is one component of what they do. And so keeping the knees turned out while you're keeping the weight on your heels will help activate the glutes a little bit more. So that's the first exercise. Now, to progress from 2 legs to 1 leg, we're going to take a half step and move to 1.5 legs. And this is to help with the activity of getting up from the floor or getting down onto the floor. And that, as you might guess, is the lunge. Now, the lunge is an outstanding glute exercise, both because you're getting hip extension like the squat, but it also requires more control on a side-to-side plane because you don't have the other leg to counterbalance you. So I'll start from the side view with the lunge. It is a good idea if you have knee problems or if you have balance problems to use something like a chair or other sturdy object to hold on to for balance. You want to get a fairly wide stagger here. So you're going to have your weight on the front foot, on the heel of the front foot, and on the outer side of the heel. So not the inner side, but the outer side of the front heel. Then your back leg, your heel is probably not going to touch the floor. You want to be more on your toes here because you want 80% or so of the weight to be on this front leg. This back one is more just like a post and a balance. So bring it back as far as you need to so that you can sit down with the weight through the back outside of the heel here. And just going down as far as you feel comfortable going. If you have more severe knee arthritis, that may just be a little bit as you're first starting out. But just do a depth that feels comfortable to you. And as you're able to go down farther, just progress farther down. But remember, the more you keep your weight through the heel, the more glute dominant it becomes. If you start going forwards like this into a lunge, then it becomes really quad dominant. So sit back on the heel as you're doing a lunge. Now to see that from a different view, if you're looking from the front, because you don't have a symmetrical stance like with the squat, you have to control the side-to-side plane a lot more with a lunge. So get your wide stagger here, turn the knee out a little bit. That puts the weight on the outer side of the heel. Again, you're gripping the floor like you did with your toes with the squat, and then pushing through the heel of the front foot, coming back up, go down, come back up. If you are a little bit more advanced and you want to start doing it without holding on, that's okay, but don't do that at the sake of allowing your foot to drift inwards that way. So make sure that you keep your knee in a good alignment if you're doing it with the chair, and make sure that you can keep that if you're doing it without the chair. So that's the second exercise. Now progressing on to the third exercise, this becomes a fully one-leg activity. And you can do that as a single leg squat, but the way that we more functionally do single leg activities in our everyday lives is going up and down stairs. And so the third exercise is going to be a step down activity. For the step down exercise, rather than doing it like this, like you would normally go down a stair, it's easier for safety purposes, as well as being able to isolate things a little bit better, to do it sideways to the stair. So do this on the bottom step of a staircase. Your stairs would be going up that way, and the floor would be down here, or you can use an aerobic step like this one. But regardless of where you're doing it, make sure you have something like a banister to hold on to or a chair to hold on to for balance. Now, just like the previous two exercises, you want to start out setting your hip, knee, foot alignment, gripping the ground with your toes. So you make an arch there, and then the weight is again going to be through your heel, but not through the inside part of the heel that you can see here, but the outer part of the heel that you can't see. Now you're going to step up, lean forwards a little bit. That'll maximize the hip extension more than the knee extension. And then as you push up, you're going to push through the heel rather than through the toes. Again, if you push through the toes, it uses your quads more. Pushing through the heel and keeping your trunk slightly leaned forwards, that maximizes the glute effort. And then as you're doing this, try to just go down slowly, just tap your heel, and then come back up. Tap your heel and come back up. Now, if you can't do the full step length, it is okay if you're doing this on a real stair, just to go down to what you feel comfortable doing and then come back up. Or if you're using an adjustable height aerobic step, like this one, you can just lower the step down so that you are able to tap your heel all the way to the floor. And as far as repetitions, about 6 to 12 repetitions is technically ideal for strength training with all of these exercises. But if you start with something that's difficult for you and you progress it over time, you're going to get stronger. Now, just to show that last exercise from a different view, again, you want to make sure you have hip, knee, foot alignment. You don't want to allow your knee to drift inwards as you're doing this. So make sure you get a solid base in your foot. You're driving your knee out that way, and then pushing through the heel, then touching this other heel down. So those were the 3 glute strengthening exercises to help if you have knee pain, and particularly if you have knee arthritis. Now, if you are in the St. Louis area and need more help for knee pain, we'd be happy to help you out here at More for Life. And if you're watching this from somewhere else, check out our other knee pain and arthritis playlists right over here. But before you go, if you found this video helpful, make sure to give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.